I'm Dr. Naved. I'm PICU consultant in Rainbow Children's Hospital, Hebbal. Today, I wanted to discuss common cases which we come across in this season with change of weather. Is breathing issues we see commonly in 1 to 2 years of age, which is called bronchiolitis. So, unlike pneumonia, this bronchiolitis is the inflammation or the reaction of the small airways, and it's particularly very severe in kids below 1 year of age. And the common reason for is RSV virus, a respiratory syncytial virus, and there are some common other metapneumo, influenza, and other viruses. But yes, if you'll see, commonly we consider is because of the RSV viruses. So the presentation is very common. It may start with 1 to 3 days of mild cold, cough, and runny nose. Kids will have developed that, a little bit of fever. But on suddenly after few days of 2 to 3 days, they might develop breathing difficulty and will stop feeding, may get dehydrated, and very worst case scenario, they might stop breathing. That is called apnea, and may go to shock and need hospital care. So the importance is some of the kids which who are from birth a little bit at risk, I will suggest is like premature babies, those who have lung diseases, chronic lung diseases, or heart disease, Down syndrome. These are the kids who are more prone to get more severe cases of bronchiolitis, and even normal babies can have, but we have seen severe cases of bronchiolitis in this group of patients. So how do you know which are the signs and symptoms for hospital care or to take pediatrician's help is, if your kid is having high grade fever, fast breathing, that means in 1 year of age, more than 50 times per minute of breathing rate, or in a small baby up 2 to 3 months, more than 60. And while breathing, you are able to see the ribs and muscles contracting too much. Child is dull, not feeding, not passing urine. These are all signs of dehydrations. So these are severe sign which may tell you that no, child needs some hospital care. So I will suggest to bring the child as soon as possible to the emergency, and he will need some in-hospital care. So what we do here is we suggest, if we ensure that whether which group the child fits. If it is a mild case of fast breathing, little bit of, but baby is taking food, we with initial care we give them medicine like saline water drop for nose, and some nebulization, saline nebulization, and send them home with warning sign explaining about what to do at home and when to come back to hospital. So when they see the severe signs and all, and in moderate to severe cases, we do keep them in the hospital. They will need more close monitoring, because this kid may develop sudden stoppage of breathing and the dehydration, shock, and all those things. So they will need IV fluid, frequent nebulizations, clear suctioning to clean the airways, and sometimes higher medications like bronchodilators and all. Some kids might need it, not all. Yes, more, and in very severe cases, a few percentage, I will say 5 to 10% what we see, they may need PICU, ICU care also. So in that case, they may need oxygen therapy through ventilator and IV machines. But to be honest, if you take care of the child in first few days properly, hydration is kept well, nebulization and cleaning of the nose and throat is done properly, majority of them they do well. And the duration of this disease varies among kids to kid. Like in some kid it might be for 3-4 days, but some other kids it may take as long as 2 weeks. So we have to be a little careful about treating those severe cases. We might need some specialist help also, like a pulmonologist and all. We do take in some of the severe cases and all. So overall, in premature babies, how to prevent, if you'll ask me how to prevent this, in this season, I will suggest to keep the child as warm as possible below 1 year, not to expose them to cold weather too much. If someone in the family has cold, cough, use mask hand sanitize, and care of hygiene, respiratory hygiene is important. And in very small premature baby, there are some medicines and all those things which helps to prevent, but it is only for premature babies with lung diseases. So I hope this will help you to certain extent to understand bronchiolitis and what are the things you should take care, and all the best. Thank you.